What is disease? Does disease have a history? Does our understanding of what constitutes a disease change in history over time? Yes, it does. And so, how do we study the history of a disease, and how do we write the history of a disease? These are some of the most important questions that Kirsten and I will deal with in this course. I'm Gianna Pomata. I teach in the Institute of the History of Medicine at Johns Hopkins University, and I'm interested as a scholar in the study of pre-modern and early modern European medicine. I'm also interested in studying the contact and exchange between Western medicine and other medical cultures in the early modern period.
And I'm Kirsten Morsheely, a postdoctoral fellow in the Institute for the History of Medicine. I'm a historian of disease and public health in modern Africa, with a particular interest in understanding the link between how people conceptualized and attempted to control disease.
Here we're sitting in the Institute's Jacobs Room, which houses a collection of books donated by Dr. Henry Barton Jacobs, who was a specialist in treating tuberculosis. Here, we're proud to have books by great physicians like Edward Jenner, William Hosler, and Louis Pasteur. The collection contained books on smallpox and tuberculosis, two of the most dreaded diseases that have afflicted humans over the centuries. These windows tell a history of the two diseases, pairing them with the names of the physicians who played a key role in understanding and fighting such diseases. Edward Jenner, in the case of smallpox, and René Laennec for tuberculosis. You can also see the technologies the two men developed to fight the diseases. The vaccine, represented by a cow, and in the case of Laennec, the stethoscope. The window represents a history of medical science's efforts to combat disease. Now, interestingly, Jacobs chose Laennec and his stethoscope to represent the struggle against tuberculosis rather than Robert Koch, who discovered the tubercle bacillus and a microscope. A physician himself, Jacobs emphasized the role of doctors as clinicians, not as scientists. He chose one possible historical narrative over the other. There are, in fact, many ways one can tell the history of a disease.
For example, here are images of patients with tuberculosis. They provide an entry into a different history of TB, that of the patient's experience, a history of how people have experienced and responded to tuberculosis at different times and places. Such patient experiences can tell us a great deal about the societies in which people lived and the worldviews they shared. Historians have used histories of disease to trace and reveal social tensions about race, class, and gender. They have, in fact, used disease in much the same way as historians Paul Boyer and Stephen Nissenbaum made use of the history of the 1692 Salem witch trials in their book Salem Possessed. As they wrote, quote, "As a stranger makes use of a lightning flash in the night, better to observe the contours of the land which it chances to illuminate." End quote. Disease, like the lightning flash, can reveal aspects of a society that often remain obscure in ordinary times.
We also need to ask, what is this thing that we call tuberculosis, for instance? Tuberculosis is a relatively recent term defining a disease caused by the tubercle bacillus. The term reflects a biomedical view of disease as a distinct entity, something that exists out there in the world as a thing in itself. It is a view that was largely alien to earlier generations of physicians and patients. Pre-modern physicians, steeped in the Hippocratic Galenic tradition, understood disease as a process, something that happens to a patient. They saw symptoms as the product of shifts in humoral balance, shaped by the influence of environment and behavior on an individual's innate makeup or constitution. Viewing disease as part of the historical process means to take seriously the disease categories and etiologies of earlier times, rather than simply trying to see them through the lens of current biomedical knowledge.
Here, for instance, you see a few books that exemplify some of the multiple ways one can write about the history of a disease, in this case, tuberculosis. Each book looks at the experience of a specific place and time. Each author takes a particular angle to study the disease. Sheila Rothman, for example, tells how people living with tuberculosis in the 19th and early 20th century experienced the disease very differently depending on their social status and their gender. Emily Abel shows how TB became a marker of class difference and racial discrimination in Los Angeles. In his book, White Plague, Black Labor, Randall Packard, one of the professors in our course, used the history of TB and TB control as a way of exploring the human suffering produced by the rise of racial capitalism in South Africa over the course of the 20th century.
In this course, we will examine a variety of approaches to the history of disease in different times and places. We will discuss how these different approaches are conceptualized and the contribution each makes to the history of medicine in society. We will do this by focusing on some specific diseases and emphasizing how people sought to comprehend their meanings and the prevailing cultural and scientific norms that shaped their thinking.
Each week, we will examine a different disease. Some of these, like malaria, diabetes, and various forms of sexually transmitted infection, will be familiar to you. Some, like green sickness, Wenbang, and breakbone fever, probably not so much. Each topic will be introduced by a lecture with assigned weekly readings. Each week, we will also hold discussions based on these readings, whether through synchronous live talks on Adobe Connect, asynchronous week-long voice threads, or discussion forums.
So, we hope you'll join us as we explore the fascinating history of disease.
We look forward to meeting you online.
Welcome on board.